Well, let's try to get a little more actionable with stocks and so forth here. So let's talk about healthcare facilities. The nursing homes, the psychiatric hospitals, the acute care hospitals. Why don't you talk about how Medicaid changes impact and the ACA law impact these hospitals? And going back, let's start out. There was a lot of mergers and acquisitions going on. Why was that? What's going on?
Among the nonprofits or the for-profits?
I don't quite remember, to be honest with you. What's the M&A going on to anticipate the ACA?
There's tons of M&A going on, and it's happening really in kind of three spheres the way I think about it. First of all, amongst large insurance carriers, they have all been on a buying spree of buying Medicaid managed care companies. There have been 3 acquisitions for a grand total of $15 billion in that space in the last 12 months.
Okay.
And I think the rationale there, if you're a carrier that has a lot of commercial insurance businesses, you want to bulk up on this Medicaid managed care because it's happening. It's lower margin business, but really nice revenue business, and it's probably not going anywhere. It's growing. And it's a nice sort of counterbalance to your commercial risk exposure side. There's been lots of M&A activity amongst hospitals and mergers and bulking up and trying to get bigger because, in my mind, I'm very simplistic. Healthcare always boils down to providers versus payers, and everyone's trying to bulk up because who knows what the future is. So you see hospitals continue to expand, and the for-profit hospitals in particular, the Vanguards of the world and others, are expanding their territories quite significantly. And the third M&A has been the M&A where hospitals are buying physicians, and that's to your point earlier,
scary.
Of hospitals buying primary care doctors and high-intensity specialists, particularly cardiologists. That has happened at a record pace, and by some accounts, 25% of physicians worked for some kind of hospital 10 years ago, and it's 75% have some sort of a direct financial relationship with a hospital as much as being salaried.
Which is very scary, because there's one way in the place in the healthcare system where you're actually going to, this is what an ACO is supposed to be, Don Berwick, you want to get the doctors educated so that they understand that if they talk to their patients more often, see them more often, talk to them about their drug use and their formularies, keep them healthy and out of the hospital, that saves the system money and doctors will be happier and they'll make more money. What's happened, because docs have gotten scared, all the best intentions with ACOs, which I'm a fan of, so a lot of physicians have gotten scared and said, oh my God, what am I going to do? I better sell to the hospital. Well, when the hospital owns the doctor group, guess what they tell them and want them to do? Fill up hospital beds, which is the most expensive part of the system. So it's very scary to me as a policy person that physicians are selling to hospitals in droves. And I can tell you, you look at Northern Virginia.
There's something going on in New York related to this. Emergency rooms are popping up all over the place that are independently owned because there's long wait times and so forth, and a lot of the hospitals are shutting down. But those hospitals, because they don't have the motivation to do tests to make these are standalone clinics. They're not part of a big tertiary care center. So you can go in there and get your broken knee or whatever, your chest pain treated for a fraction of what it costs if you were to go to an ER attached to the hospital, which is related to what you just said, where if you're a doctor whose group was bought by the hospital, then there's pressures to do more stents. And
there's also no place to go. So if you're an insurance company, I live in Northern Virginia. Everything within 25 miles of Washington, the Northern Virginia side, is owned by Inova, a giant chain. They own everything. So if you're Blue Cross or Aetna or somebody else trying to go in there and trying to get it efficient, they just thumb their nose at you. You can't go anywhere. And that's happened all over the country. You've got massive
Massachusetts is really the epicenter of this. Are you seeing changes?
Well, it was really 10, 15 years ago that kind of certainly the greater Boston area saw just a whole lot of consolidation among the academic medical centers. From a policy side, there's a real tension here. In the long run, if we do end up moving towards more something like an ACO, those incentives will be internalized in the organization. You won't have hospitals saying to doctors, admit your patients for high-cost things because they won't be getting paid extra for it. That's in the kind of ideal steady state.
Somewhere down the line.
Exactly. We're not there, and we're nowhere close to it yet. But the short-term issue is is pricing, right? I mean, so you have concentration of market power on one hand, which is obviously not good for healthcare costs and competition and choice. But on the other side, we're saying everyone universally agrees that healthcare in the U.S. needs to get more integrated. That we're too fragmented, and we have the right hand doesn't have any idea what the left hand's doing, and we're providing redundant, ineffective care. So that's the quandary we're in. It's not there's no easy answer to say we just want everyone to be operating independently in small group practices.
Markets that are operating right, which is what the ACO model was. If you look at the best HMOs in the country and the best models in the country, California's built totally around this. It's the physicians. Physicians admit patients, not hospitals. Physicians drive the patients. And you want to get to a position where the physicians understand the care, understand that if they're being more efficient, they're going to save money, and their incomes will be better, and the patients will be happier. And that's what happens with healthcare partners and JSA Medical and some of these better plans where the physicians are really involved in the economic decisions. When you get the hospital driving the economic decisions and the physicians are along for the ride, That's when
Yeah,
costs
so,
take
well,
off.
let's get back to the industry aspect of it again. So what were you saying there? Which industries? The hospitals, the nursing homes, the HMOs. What can we make?
Who
of
will
this?
benefit and who will not, given
Exactly.
Medicaid expansion?
Yeah,
Well, I think
yeah.
it's, look, sort of my general lens of looking at this is that over the next 20 years, no matter where you are in healthcare as a for-profit company, no matter where you are, whether you're an insurer, a medical device company, a pharma company, or a hospital, your revenue is going to go up, and your gross margin, your profit per dollar of revenue, is going to go down. And I think, and that includes doctors too. Everybody's going to make less profit for the unit of care delivery. There's going to be a heck of a lot more procedures and people to treat.
We're seeing that with medical devices in the cardiology space. The prices are way down, the profit margins are down.
That's right, and I think Medicaid expansion might be part
But
of
the
that.
volumes will go up.
I think what will happen to Medicare over the next 10 to 20 years in terms of its managed care increasing will be part of that, and bundled payments and ACOs, where the power of the hospital is so much greater. And if you're a doctor, you can't choose from 5 different stents. You've got one stent to put in.
You know, we're the biggest, in the same business, we're the biggest U.S. investor in healthcare. My partners all kind of Romney guys. And the reality is, for the healthcare point of view, President Obama, whether you like it or not, is going to spend $200 billion a year more per year on healthcare. So all docs are going to rise if the ACA stays in place. It's a lot of money in the health system.
President
It's good
Obama
for
is
everybody.
elected and ACA stays in place. Who's going to benefit?
Everybody in the healthcare sector, because it's just a flat-out slug of a
Your
lot more
revenue
money
will
going
go
to
up.
healthcare.
You may not be as profitable for the unit of revenue, but I agree with you. I think
You have a lot more people coming in who are insured. And I have a fundamental problem with the fiscal discipline of that. But if you're in the healthcare business, you definitely are better off with Obama across the board. And if you're in the healthcare business,
The higher
wins will be tougher.
the higher mix of Medicaid, assuming everything goes forward, will hurt, as you said, the profit margins. So therefore, you can't command price increases of 10% on ortho hips every year.
It depends on where it's coming from. If it's only replacing
all new
uninsured,
people, yeah.
if they're new patients, and that's more revenue. If you're replacing basic people can't pay at all, or people who pay some fraction and then go into bad debt, that's different. If we're scaling out private insurance, which most critics of the law have some concerns on the exchange side, that the exchange may crowd out employer coverage. I have not seen any kind of credible estimates that there's going to be a major crowd out from the Medicaid side on the private insurance. Prior expansions has shown some. The more recent ones that several states have done has shown very little. So I think we're mostly talking about some uninsured people coming into Medicaid, and then what's happening in the commercial market.
There's
They're
no
whole separate
downside if you're
issues.
in the healthcare business if this thing stays in place. As I've said, if you're in the healthcare business, vote for Obama. If you have a conscience about the budget deficit, you might want to vote for Romney.
If you're at a hospital, though, I think it puts extra pressure on your contracting on the commercial side to get better margin in your commercial business.
Everything in here is pretty good for hospitals. Fundamentally, this is not a
ACOs
cost containment bill. It's an expansion of coverage bill. There's very little cost. There's a couple good ideas in there like ACOs.
If we get
that are
bundled
incrementally
payments
better.
through individual state reform, and then also the measures that go through with the ACA law, all of those don't sound to me like something I would like to hear as the CEO of Medtronic. I don't know.
I think the CEO of the medical device companies, and by the way, of the 8 major U.S. medical device companies, there's 6 new CEOs in the last 12 months. I think they're all putting together